Hi everyone, welcome to PharmaExplora. Today we are going to discuss another interesting topic, that is the practical and clinical applications of pharmacokinetics, or in other words we can say the importance of knowing pharmacokinetics. So in our previous discussions we have discussed that pharmacokinetics is what our body does to the drug. And this pharmacokinetics being explained in a formal way, the effect of biological systems on drug molecules. So we explained that pharmacokinetics define the movement and fate of a drug molecule from the moment it enters to our body until it leaves from our body. So to explain this complex journey, we use the universal framework called ADME. So ADME stands for absorption, distribution, metabolism and elimination. So today we are going to discuss how knowing this ADME principle or the pharmacokinetic information is going to be valuable for our practical setting. So let's get started. Okay, now once a drug molecule is administered through one of the available routes, the four pharmacokinetic parameters are going to determine three important outcomes. Those are the speed of the onset of the drug action and the intensity of the drug's effect as well as the duration of the drug action. So let's discuss one by one. So today our main theme is practical application in pharmacokinetics. So hope you remember we define pharmacokinetics as what body does to the drug. So we define pharmacokinetics as what our body does to the drug. In formal way, we define pharmacokinetics as the effect of biological systems on drug molecules. So we explain that this pharmacokinetic explains the movement and the fate of the drug molecule from the moment it enters to our body until it leaves from our body. So to understand this complex journey, we used universal framework called ADME. So to understand this framework, we used universal framework called ADME. ADME framework. So ADME framework, this ADME, each letter denoted by a word. So ADME stands for absorption, D for distribution, M for metabolism, and E for elimination. So these four, the absorption, distribution, metabolism and elimination, are also defined as the four pharmacokinetic parameters. Four pharmacokinetic parameters. So today our discussion based on the practical applications of knowing these four pharmacokinetic parameters. So these four pharmacokinetic parameters are going to determine three important outcomes. So these four pharmacokinetic parameters are going to determine three important outcomes. The first one is the speed of the onset of the drug action. First one, speed of the onset of the drug action. Speed of the onset of the drug action. So speed of the onset of the drug action is how fast your drug is starting to work. How fast or how quickly your drug starts to work is the speed of the onset of the drug action. And the second one is the intensity of the drug's effect. Intensity of the drug's effect. Intensity of the drug's effect means how strong your drug's effect is. How strong your drug's effect is. So intensity of the drug action. And the third one is the duration of the drug's effect. The duration of the drug's effect. So duration of the drug's effect means how long your drug's action is going to last. How long your drug's action or the relief you are getting from the drug action is going to last. So that is the duration of the drug's effect. So today we are going to discuss about the practical applications of pharmacokinetics. So we explained that these main four pharmacokinetic parameters, absorption, distribution, metabolism and elimination, are going to determine three important outcomes. Those are speed of the onset of the drug action, intensity of the drug's effect and the duration of the drug's effect. So speed of the onset of the drug action we define in simple way as how quickly how quickly your drug starts to work. Then intensity of the drug effect we define as how strong your drug's effect is, and the duration of the drug's effect we define as how long it will take to last your drug the action before you take another pill. So now we are going to discuss, take a simple example and discuss how these four pharmacokinetic parameters are going to determine these three important outcomes. Okay, now we are coming to the most interesting and the most critical part of our discussion. Now we are going to take a simple example and we are planning to discuss how these ADME framework are going to determine these important outcomes. So let's take, suppose you are taking a fast-acting painkiller pill for your headache. So our example is you are taking fast-acting painkiller pill. Fast-acting painkiller pill for your headache. So this is our example we are going to discuss. Now we know when we are taking a medicine, the pharmacokinetic explains what our body does to that particular medicine. So this painkiller pill will undergo these 4 pharmacokinetic steps: absorption, distribution, metabolism, and elimination. Now we are going to discuss how these 3 outcomes are going to determine by these 4 the ADME framework. Now this you are taking a fast acting painkiller pill. So you are taking that painkiller through your mouth. So the first step that painkiller pill undergo is absorption. So absorption is the very first step this painkiller pill undergo. So you will take that painkiller pill through your mouth. It will go to your stomach. It will dissolve in the stomach and enter to the bloodstream. So hope you remember that we define the absorption as the process of movement of the drug molecule from its site of administration to the bloodstream. So absorption we define as the movement of a drug molecule from its site of administration to the bloodstream. So you can see sooner the absorption is, the sooner you will feel the relief. So the speed of the onset of the drug action means how fast or how quickly you will start to feel the headache fade away. So how fast or how quickly you will start to feel that headache fade away is explained by speed of the onset of the drug action. So you can see if the absorption is quick, the absorption is high, the medicine will start to work quicker. So the absorption is the main parameter that is going to determine the speed of the onset of the drug action. So let me explain it again. So once you take the fast acting painkiller medicine through your mouth, so it will go to your stomach and it will dissolve in your stomach and absorb to the bloodstream. So absorption we define as the process or the movement of the drug molecule from the site of administration to the bloodstream. So speed of the onset of the drug action we explained as the how fast or how quickly your medicine is going to work. So in example, speed of the onset of the drug action means how fast or how soon your headache is starting to fade away. So you can now see this absorption is the primary the parameter that is going to determine how fast the medicine starts to work. So speed of the onset of the drug action primarily determined by the absorption. If the absorption is high, the speed of the onset of the drug action is going to be high. So that is how our first outcome, speed of the onset of the drug action, is going to determine by the absorption. The pharmacokinetic parameter, very first one, absorption. Then what will happen to this drug molecule? It will distribute. So I hope you can remember we discussed the distribution is the drug molecule reversibly leaves the bloodstream and enters to the interstitial fluid and eventually into the intracellular fluid. So distribution is the process where these drug molecules will enter into the targeted cells. So the distribution is the process which drug molecules will enter into the targeted cells. So our second outcome, intensity of the drug's effect, means what? How strong the drug effect is. How strong? How strong? How strong the drug effect is. In our example, we can say how much of pain actually reduces. How much of a pain actually reduces the intensity of the drug's effect. So you can see the distribution is the factor that is determine the intensity of the drug's effect. That means if more drug molecules distributed to the targeted cells, if more drug molecules distributed to targeted cells, the pain will completely fade away. So distribution is the second important pharmacokinetic parameter that is going to determine the intensity of the drug's effect. So if the distribution is efficient, and efficient and the given dose or the amount of drug is correct, dose is correct, your headache will completely fade away. So your headache will completely fade away. In other words, the mm, the the drug molecule will be able to provide the drug action intense enough to reduce the headache. So the distribution primarily determine the distribution is the pharmacokinetic parameter that will determine the intensity of the drug's effect. And now we are going to discuss about the metabolism and elimination. Now we know in our case this taking a fast acting painkiller pill for headache. Now what will happen? These drug molecules go to the liver and it will metabolize into its metabolites or its inactive form, and it will eliminated through through kidneys via urine. So the metabolism and elimination will remove or the metabolism and elimination will first convert or biotransform this drug molecule into its inactive form, and eventually it will remove or eliminate from our body. So our third outcome, duration of the drug's effect. Duration of the drug's effect means how long the relief, you will feel the relief from the pill you are taking before you take another pill. That means the duration, how long your relief lasts before you take another pill. So this how long your relief feels primarily determined by the metabolism and elimination. Why? Metabolism and elimination convert these drug molecules into its inactive form by liver, and it will eventually eliminate it through kidneys via urine. So there will be no drug molecules to provide this therapeutic effect. So the metabolism and elimination will be decide the duration of the drug's effect. So the duration of the drug effect, the drug can provide the effect as long as it can stay in its active form. So if we converting or if we are biotransforming this molecule into its inactive form, the drug cannot produce its effect. So the metabolism and elimination is the step that is determine the duration of the drug's effect. So now you can see how this ADME framework or the absorption, distribution, metabolism, and elimination are going to determine these three important outcomes: speed of the onset of the drug action, intensity of the drug's effect, and the duration of the drug's effect. So the speed of the onset of the drug action, or the how fast or how quickly you will feel the relief, or your headache will start to fade away, mainly determined by the absorption. The intensity of the drug action, or the how strong your drug's effect is, or how much of a pain will be relieved from this pill, is mainly determined by the distribution. And the duration of the drug's effect, and or the how long your relief lasts, primarily determined by the metabolism and elimination. So this is how these four pharmacokinetic parameters are going to determine these three important outcomes. Now, this is very important. Why? Using this data, the clinicians clinicians design and optimize the treatment regimes. So they decide the best route of administration, the dose and the frequency, as well as the whole duration of the treatment. So using this data, clinicians are determine the most suitable route of administration. What is the best route to give a particular medicine? Route of administration, the dose and frequency. Dose is the how much amount should be given at a particular time, and frequency is how often you should continue this treatment. And third one, the overall duration of the treatment. Overall duration of the treatment. Overall duration of the treatment. So these three important decisions are taken by the clinician using this information. That is why this pharmacokinetic, knowing the pharmacokinetic information is very important in practical setting. Okay, to wrap up, today we discussed about the practical aspects of pharmacokinetics. So we define the pharmacokinetics as what our body does to the drug. So we explain the pharmacokinetic is determine the fate and movement of the drug molecule from the moment it enters to our body until it leaves from our body. So to understand this complex journey, we use an universal framework called ADME. So ADME stands for absorption, distribution, metabolism, and elimination. And then we discussed how these four pharmacokinetic parameters are going to determine the speed of the onset of the drug action, intensity of the drug action, as well as the duration of the drug action. So to conclude, we can say this pharmacokinetic information ensures that patient is receiving the correct medicine at the correct dose, at the correct frequency, through the correct route of administration, and also within the correct duration. So I hope you learned something from this video. So if you find this video helpful, just hit the subscribe button and stay tuned for next session. Thank you for joining PharmaExplora today. See you soon.